Welcome to the Alameda County Command Training Module. As the pod site manager or member of the command team at the pod site, you have a unique position. Not only are you responsible for supervising the pod's success, but also for communicating up the chain of command and working as part of the broader network of disaster response. Your mission is twofold. First, monitor and maintain client throughput by managing staff, supplies, and resources to eliminate bottlenecks and keep the flow moving. And second, establish and maintain a reporting link up the chain of command to your city emergency operations center. It's important that everyone in command remember that the pod is part of a bigger preparedness plan, and your role dispensing medications or vaccines is a core element. Each pod should have a specified target throughput level, the rate of dispensing that your pod is expected to achieve. Meeting or beating that throughput level will save lives. Population size determines the number of pods in your area. The CDC recommendation is 1 pod per 20,000 populace, but the actual numbers you'll need to treat can fluctuate. Alameda County's numbers may be much higher based on need. Conventions, sporting events, or evacuations, as well as tourists and commuters, can change the numbers you can expect at your pod. The command structure for your pod is determined by your city to fit into your existing local emergency plan. But all agencies now use the Incident Command System, or ICS, as the basic model. Knowing the Incident Command System will allow you to easily recognize roles and work with other emergency organizations. Just as the staff at the pod goes through shift changes, so do the staff at the city's operational areas and above. It's important that you always ask for contacts by ICS role and not name, because different staff will rotate through these roles. The next step up the chain of command from your pod is your city's Emergency Operations Center, or EOC. For some events, your city EOC may not be activated. If activated, the Emergency Operations Command at the operational area level will contact your city's EOC to initiate their pod plans. Your city EOC will then activate the staff and locations of their pods. Your city EOC makes sure that you have everything you need at your site over the course of the emergency. So while you're busy setting up and operating your pod, they're busy coordinating supplies and personnel to support you. Public health emergency response occurs at many levels: federal, state, regional, county operational area, and local city. Your pod's only one aspect of a much larger emergency response plan. Depending on the size of the emergency, you may be one of several pods under your city EOC's jurisdiction. Your command team must maintain regular communications with the city EOC. It's essential that your city EOC know what's happening in your pod in order to adapt to changing conditions. Your relationship to the nearest hospitals is important too. If you encounter ill people at your pod, you may need to send them to the hospital. And accidents or medical emergencies like heart attacks can still occur during pod operations. A full command team includes the pod site manager, liaison officer, security officer, safety officer, public information officer, and section chiefs for the 4 ICS divisions: operations, logistics, planning, and finance administration. The pod site manager is the top decision maker in a pod. They ensure that the pod functions at the highest level of efficiency possible with the given staff and supplies, while coordinating communication up the chain of command to the city EOC. The pod site manager, or designee, is responsible for sending regular reports to the city EOC using adapted FEMA incident command forms. Upon activation, The pod site manager should receive a briefing from the city EOC. Make sure you understand your full mission and communicate any concerns or problems you foresee. The pod site manager should then conduct their own staff briefing and set procedures for the rest of the shift. 3 rules to keep in mind. First, identify key pod staff who you want to report only to you. Second, remind pod leaders to restrict decisions to their defined role responsibilities listed on their job action sheets. And third, judiciously delegate authority. Never try to do everything yourself. Make sure all pod staff have a clear idea of the facility layout, the location of stations, break rooms, restrooms, and exits. The briefing is also a good time to remind staff that only the PIO or designee should communicate with media personnel, but only after direct city EOC clearance. The pod site liaison officer is the point of contact for assisting and cooperating agency representatives. These include representatives from fire departments, Red Cross, law enforcement, public works and engineering, ham radio operators from the Radio Amateur Civil Emergency Service, parent-teacher associations, and other community or official agencies. The pod site public information officer, or PIO, will coordinate information releases at the pod and media activities with the County EOC and Department of Public Health. The pod site PIO should review all signs and pamphlets to make sure they're correct and should update personnel, especially greeters, Q&A staff, and their supervisors, on updated public information. Neither the pod site PIO nor any staff member is to provide information or interviews to the media. This allows the pod to perform operations without being distracted by media requests and to provide a consistent and coordinated city message to the public. Some pods may not have a public information officer. In this case, the pod site manager may designate another command person or appoint themselves as acting pod site PIO. If uncleared media personnel do arrive on site, you should consider keeping them separated from the rest of the normal pod functions. And always remember that HIPAA laws require medical information to be kept discreet. The pod site security officer will typically be from local law enforcement. They have the responsibility for providing pod security. Normal security activities include maintaining deterrent presence and making regular security sweeps of the pod and perimeter. Unlike most other positions in the pod, this is their regular professional role, and they're likely to know how to perform it very well. Make sure that they're briefed by the safety officer on any health concerns or personal protective equipment procedures. The pod site safety officer is responsible for ensuring the pod is free from health and safety hazards and that illness and contamination do not spread. They should focus carefully on personal protective gear, biohazard waste disposal, and making sure that sick patients are identified early and quickly separated from the main population. They should also make sure that staff get regular breaks and should be alert for signs of stress in staff behavior. Filling out the command staff are the ICS section chiefs for operations, logistics, planning, and finance administration. They all have unique duties, but operations and planning complement each other in the dispensing mission, while logistics and finance complement each other in supply and personnel support. The operations section chief has responsibility for all dispensing and clinical areas of the pod, and, like the other section chiefs, should offer recommendations to the site manager to solve any problems in their section. The planning chief maintains a clear picture of the pod status and anticipates potential problems. They're often delegated the responsibility of reporting status to the city EOC and higher levels of the response. Documentation also falls to the planning section, and after their initial use, All patient forms, staffing lists, and unit logs should be routed to the planning section for review and filing. This is an important function, and even though we'll not detail forms here, the command staff should remember that behind every successful emergency operation are records that serve critical support functions during and after the emergency. And in the case of an extreme situation, say if a code red paperless pod is initiated, other forms of documentation become even more important. The logistics section chief is responsible for all support needs of the pod, including supply, communication, food and water services, maintenance, and personnel. The finance administration section chief is responsible for creating an audit trail of receipts and inventory records. They're also accountable for all payments and purchases made on behalf of the pod. This function may occur at the city EOC level and not at the pod level. However, you must still make sure someone at the pod is prepared to collect receipts and handle injury and damage claims. Sometimes the finance section takes on the role of routinely reporting supply issues to the city EOC. As part of the pod command, you're encouraged and expected to adjust when necessary to make the pod successful in its mission. You need to monitor throughput and feel empowered to make changes to troubleshoot problems. Shift changes present special challenges to the command staff. If you're not the activation team, many procedures will already be established. So shift changes should occur with enough overlap for shifts to pass along valuable practices. You should also give new shift members time for supervised job action training at their assigned stations. So to review, command staff have the biggest responsibility for pod success through their leadership and decision making. Make sure you know and respect the chain of command. Report your operational results to your city EOC on a regular basis. Work as a team and keep your focus on the mission. Be adaptable to changes that can save more lives. And remember that the command staff has the authority and responsibility to open the pod, oversee all activities, and then close the pod at the direction of the city EOC. When the pod is closed, logistics has the responsibility of restoring the space to pre-event readiness, but command has the responsibility of signing off on it and locking the door. Thank you for using your leadership skills to assist all of us in this emergency response. This pod video training series is brought to you by the Alameda County Public Health Department, Office of Public Health Emergency Preparedness, in collaboration with Applied Creative Training, Inc.